According to the Occupational Safety and Health Administration, or OSHA, 2.3 million people are exposed to respirable crystalline silica at work. Silica, or silicon dioxide, is a common mineral and is a major component of many types of rock and sand. It is also present in many building materials, including concrete, mortar, and drywall. Silica is used to make glass, pottery, ceramics, bricks, and more. Respirable crystalline silica, or RCS, are very small particles of crystalline silica, at least 100 times smaller than ordinary beach or playground sand. It is created by cutting, sawing, grinding, drilling, or crushing materials that contain crystalline silica. When you have successfully completed this course, you should be able to recognize the health risks of exposure to respirable crystalline silica and the job tasks that may involve silica exposure. You should also be able to identify standard methods for preventing and controlling silica exposure. Lesson 1. Silica and your health. When RCS is inhaled, the tiny particles are pulled deep into the lungs, where they cause scar-like patches known as fibroids. They also cause swelling of the lung tissue and lymph nodes. The fibroids and swelling make the lung tissue less elastic and less efficient at transferring gases, which makes breathing more difficult. If enough fibroids develop, they cause silicosis, which is a type of pulmonary fibrosis. The most common form of silicosis is chronic silicosis, which occurs after 10 or more years of repeated exposures to low or moderate levels of RCS. Symptoms develop gradually and may not be obvious at first. The first noticeable sign is usually shortness of breath, or sometimes an abnormal chest X-ray with no symptoms. In later stages, the worker may begin to develop a cough, fatigue, and chest pain. Eventually, the damage can lead to respiratory failure. Workers who are exposed to higher levels of RCS may develop accelerated silicosis, which generally appears after 5 to 10 years. Symptoms are similar to chronic silicosis, but develop more rapidly, and may also include weight loss and weakness. Workers exposed to extremely high concentrations of RCS can develop acute silicosis, which can appear anywhere from a few years to just a few months after exposure. With acute silicosis, the lungs become highly inflamed and fill with fluid, causing severe shortness of breath, cough, fever, and weight loss. Acute silicosis can be fatal within a few months if not properly treated, or if complicated by other health factors. All forms of silicosis can lead to lung cancer, kidney disease, tuberculosis, and chronic obstructive pulmonary disease, or COPD. The development of silicosis is influenced by several factors. These include the amount and kind of silica dust inhaled, the size of the inhaled particles, and the length and frequency of exposure. The age and overall health of the worker are also factors. Smoking tobacco or having a pre-existing lung condition will significantly increase the risk of developing silicosis. Because crystalline silica is present in so many materials, there are many different tasks that could expose you to RCS on the job. Manufacturing, processing, cutting, drilling, sanding, and abrasive blasting of brick, concrete, cement, asphalt, drywall, mortar, plaster, granite, limestone, slate, stucco, and many other materials can all release silica particles into the air. Some of these particles may be large enough to create a visible dust cloud, but invisible, respirable-sized particles may also be present. Sometimes RCS can be present without a visible dust cloud. Many common construction tasks, such as using jackhammers to break up a paved surface or using heavy equipment for grading and excavating, can create large amounts of airborne RCS in a short time. Demolition, tunneling, hydraulic fracturing, foundry work, metal refinishing, electronics manufacturing, dental laboratories, agricultural services, and even food and beverage processing can all create RCS exposure risks. It is important to remember that even if you aren't the person performing a task, you can still be exposed if you are close to someone generating silica dust. Lesson 2. Preventing RCS exposure. The only way to protect workers from silicosis is to prevent or control exposure to silica-containing dusts. Certain common construction tasks that create exposure to RCS are listed in Table 1 of OSHA's Silica Standard for Construction. The table lists each task and a set of controls. These include engineering controls, such as dust collection or water delivery to control dust, and work practice controls, such as using HEPA air filters when performing certain tasks. Table 1 also contains minimum respiratory protection requirements. These are the required controls for those tasks, and when they are fully and properly implemented, they should provide adequate RCS control. Below the table are a few additional requirements that apply to all tasks on the table, such as the requirement that tasks performed indoors must have ventilation to remove visible dust from the air. Employers may choose to use the specific controls listed in the table for these tasks, rather than performing a risk assessment and developing their own controls. If any of the required controls in Table 1 cannot be fully implemented, or if there are any other tasks in your workplace which could create RCS exposure but are not listed on Table 1, then your employer is required to perform exposure assessments for all employees who might be affected. They can do this by either monitoring the actual exposure of each employee or by taking a representative sample following steps outlined by OSHA. You may be required to participate in the monitoring process by wearing a sampling device attached to you in a way that does not obstruct your work. Do not alter or remove any devices for monitoring without permission. Your employer must notify you of the results of your exposure assessment within 15 days for general activities or within 5 days for construction activities. If RCS exposures for any employees are at or above the action level, then your employer will create a written exposure control plan and will perform routine monitoring to watch for changes in exposure levels. Your employer must reassess exposures whenever a change in production, process, control equipment, personnel, or work practices could create new or additional exposures, and any time that they have reason to believe that new or additional exposures at or above the action level have occurred. An exposure control plan will outline all of the tasks in the workplace that involve exposure to RCS and the controls used to limit employee exposure. When necessary, it will also include information about how to restrict access to RCS work areas to prevent unnecessary exposures. OSHA sets a limit for worker exposure to silica called the Permissible Exposure Limit, or PEL. Any area where exposure to RCS will be more than the PEL must be clearly defined and marked as a regulated area. Access to this area must be limited to people authorized by the employer and required by work duties. People authorized by the Occupational Safety and Health Act or regulations under it, and designated employee representatives observing monitoring procedures. Signs must be posted warning people of the boundaries and risks of the regulated area. Lesson 3. Controlling RCS exposure. Engineering controls are changes to the design of equipment and processes that reduce or eliminate contact with a hazard. For RCS, two of the most common engineering controls are using wet processes to suppress dust and using local exhaust ventilation and dust containment systems to capture dust particles at the source. Isolating workers from the hazard, such as protecting heavy equipment operators with an enclosed cab or booth, is also an effective control. The most important work practice control for RCS is maintaining proper facility hygiene. Follow all policies designed to keep RCS contained to designated work areas. Never dry sweep or dry brush silica-containing dust unless no other safe method is feasible. Do not use compressed air to clean clothing or surfaces unless the compressed air is used with a ventilation system that captures the dust cloud created, or no alternative method is feasible. You should always attempt to use the safest method first. And if you have questions about the best method to use, ask your supervisor. When doing tasks that will expose you to RCS, you should wear either disposable or washable work clothes and shower when you're finished if facilities are available. If you're using washable work clothes, before leaving the work site, make sure to vacuum any dust from your clothing and change into a clean outfit. Do not bring dust home with you. It puts those in your home at risk. Avoid smoking. Smoking can add to the lung damage caused by silica exposure. When in the work area, do not eat, drink, smoke, or apply cosmetics. Only do so after you've left the work area and wash your hands and face. Finally, make sure you alert your physician that you are or have possibly been exposed to silica dust at work. All employees at risk of RCS exposure must be properly trained over the risks and how to protect themselves. You should be familiar with the specific areas and tasks in your workplace that might expose you to RCS. Materials that contain silica and processes that can generate RCS must be properly identified with signs and labels. There must be safety data sheets available for silica-containing materials, just like any other hazardous materials or chemicals. You must also be trained over your facility's exposure control plan, including the specific ways employees are protected from RCS exposure. A copy of the plan must be made available to you upon request for examination and copying. You must also be trained over any medical surveillance programs in your facility and your medical safety and privacy rights. Finally, you should be familiar with the OSHA Silica Standard and any other standards that are relevant to the work you will be doing. Click the links on your screen to open copies of the Silica Standards for General Industry and Construction. Additional OSHA standards can be found online at osha.gov. In some situations, engineering controls and safe work practices will not be enough to reduce RCS exposure as much as required. In those cases, respiratory protection will also be needed. If you are required to wear respiratory protection on the job, your employer must provide you with an appropriate respirator and any necessary filters or cartridges. They must have an OSHA-compliant respiratory protection plan and train you over the plan. You must also be trained to properly use, clean, and store your respirator. You will also be required to undergo a medical evaluation and fit test to ensure that you are able to wear your respirator safely. For some substances, OSHA designates an action level. If workers are exposed to this substance above the action level, medical surveillance will be required. Each employee who will be occupationally exposed to RCS at or above the action level for 30 or more days per year while performing general industry operations, and each employee who is required to use a respirator for 30 or more days per year performing construction operations, must be provided with medical surveillance at no cost and at a reasonable time and place. It should involve a medical and work history with an emphasis on silica exposure, a physical examination and chest x-ray, a pulmonary function test, and an annual evaluation for tuberculosis. The medical surveillance, along with any other related exams and procedures, must be performed by a physician or other licensed healthcare professional, or PLHCP. Medical exams must be provided at least every 3 years, or more frequently if recommended by the PLHCP. The PLHCP should explain the results of the exam to you and provide you with a written medical report, including a written opinion regarding your condition. Now that you have successfully completed this course, you should be able to recognize the health risks of exposure to respirable crystalline silica and the job tasks that may involve RCS exposure. You should also be able to identify standard methods for preventing and controlling RCS exposure on the job.